Hello, my name is Sungwon Her, and my project is the impact of SCD1 on the mechanism of ferroptosis in breast cancer. So breast cancer is actually the most commonly diagnosed form of cancer and is also the second leading cause of cancer deaths among women globally. The disease is generally less dangerous at lower stages, but when it reaches around stage 3 or stage 4, it can actually begin to metastasize, meaning that it spreads to other parts of the body and it makes it significantly more difficult to treat, and also the survival rate plummets. One of the main elements that influences this kind of breast cancer development, progression, and metastasis is something known as the tumor microenvironment, or the TME for short. A tumor is never just the tumor. It also has all of its complex surrounding environment in which it exists in and also interacts with. The tumor microenvironment can be composed of so many different things, but there's blood vessels, there's immune cells, and specifically in breast cancer's case, we have adipocytes or fat cells. And this is because a healthy human breast already contains a large portion of these adipocytes, meaning that, the tumor kind of just hijacks them. And within a tumor microenvironment, these tumor cells actually release signaling molecules that will actually reprogram these highly abundant adipocytes into becoming something known as cancer-associated adipocytes, or CAAs for short. These CAAs will actually highly upregulate certain functions that promote tumor growth and progression, such as breaking down their own lipids and releasing them into the TME for the cancer cells to use, whether in metabolism or in some other function. However, the exact mechanism by which these healthy adipocytes become cancer-associated adipocytes and their direct relationship with breast cancer cells remains relatively unknown. So that's what this project aims to elucidate between the two. So in one of our earliest experiments, we actually saw that a gene called SCD1, which plays a crucial role in lipid metabolism, was actually being upregulated in the CAAs. So we think that the reprogramming of the healthy adipocytes into CAAs upregulates SCD1 to secrete more lipids for the cancer cells to use in development, and in turn creates more CAAs and increases tumor longevity. Since then, although we have run several in vivo studies using a mouse model with the SCD1 gene knocked out to see its exact function and measuring its tumor growth over time, we have yet to find a specific link between the SCD1 expressing CAAs and breast cancer tumor development. So far, however, we have only focused on the primary tumor growth, but by better understanding the relationship between cancer-associated adipocytes and breast cancer development, we hope to develop new therapeutic strategies targeting not only the primary tumor, but also the metastases that may form on distal organs, which are ultimately way more detrimental to the patient. Thank you.